Kathy Joinboy, thank you for joining us today. We're going to discuss the topic of how to find a great implant dentist. With me today is Dr. David Scharf from Long Island, New York. Dr. Scharf is a periodontist and implant specialist. Thank you so much for joining us today, Dr. Scharf. How are you doing?
I'm doing great. My pleasure to be here.
So many people look for implants, thousands of them every day, dental implants online, and they come across lots of different searches of different doctors. You have a lot of expertise and experience in the field, being in practice over 20 years and the massive amount of education you've had. How would one go about finding and searching and knowing that they have a great implant dentist?
That's a great question. I think the first thing when you're looking online for someone to place your dental implants, a great place to start is to check out their reputation online. Look at their Google reviews, look at their other reviews. And again, I don't think every review needs to be perfect. You know, it's impossible for anyone to please every patient. But in general, you want to look for someone where the bulk of their reviews are positive, where the things that the reviewers say maybe strike a chord with you in terms of how the doctor treated them or what their experience was like. I think that's a great place to start to narrow down your list. And then from the reviews, once you have the dentist you want to consider, there are a number of things you want to take a look at. First and foremost really is to take a look at their level of expertise. You want to ask, well, how many implants have you done and how long have you been doing them? Certainly if you live in a metropolitan area, it will be very easy to find a seasoned practitioner who's placed thousands and thousands of dental implants. It takes several hundred dental implants just to get through your learning curve to be able to do the simple cases. And again, if you're in an area where you can avail yourself of a specialist who's done thousands and thousands, that's probably a great place to start. You want to find someone that places implants frequently, that it's a regular part of their daily practice, so they're doing implant surgery every day or multiple times a day. And that really tells you that the office is set up and it's something they do all the time. The other advantage to finding an office that does a large volume of dental implants, aside from that they're very fluid at doing it, is that they'll have a number of different implant systems available, so they can choose the implant that really will be best in your particular case. So expertise is number one. Number two is you want to take a look at their education. And there are really two ways that people get an education in implant dentistry. The first way is to attend a residency program, a bona fide ADA-approved residency, and become a specialist. So that would be either a periodontist, such as myself, an oral surgeon, or a prosthodontist. All those specialists receive dental implant training as part of their residency. And to give you an idea, those residencies are 2 or 3 years in length, sometimes more, 5 days a week. So the training is very intense. The surgeries that are done are supervised. The residents show each other their cases. There's a tremendous amount of learning going on. The other way that people obtain education in implant dentistry is through continuing education. And continuing education would be, say, a general dentist in his practice who does, root canals, fillings, cleanings, crowns, and they want to start doing dental implants in their practice but don't have any residency training. Well, they'll take continuing education courses, and that may be, a weekend course, or maybe 1 day a month for a year, or even 1 day a month for 2 years. They'll do some surgeries. There are courses people take. They go to Mexico for a week and place 10 implants or 20 implants. And you can receive good training in those programs. But if you think about a program where you go 1 day a month for 2 years, that's 24 days of education. Compare that with a residency program where you're going 5 days a week for 2 or 3 years. There's no comparing the volume of information and the level of expertise that you obtain. A famous surgeon, I don't know who the quote is attributable to, said, "I can teach anybody to do an appendectomy in about an hour, but it takes me 7 years to teach them what to do if something goes wrong." And dental implants are the same way. I could teach anyone to place an implant probably in an hour, but to give them the diagnostic acumen, the treatment planning skills, the surgical skills, and most importantly, what to know if there are complications or how to best avoid complications is something that's a little harder to come by. And then the last thing I would urge people to do is look for a practitioner who offers a warranty. So when the implant goes in to the bone, we're relying on it fusing with the bone. And most practitioners, if the implant doesn't fuse, will replace it at no charge to the patient. But there are some practitioners, such as myself, who will offer a 5 or 10-year warranty, so that if you put that implant in, the patient has the peace of mind of knowing, in the unlikely event something happens 9 years from now, the dentist will take care of it. There's no questions asked. So I think that's a pretty good starting point for people, those 3 points.
Wow, Dr. Scharf, that's some great advice. I would have never thought about a warranty for dental implants. And you brought up a good point with the fact of how many implants you as a periodontist and implant specialist does, as opposed to maybe somebody who has just brought that on as a service. You know, and I think the other tip that you offered as far as checking out the doctor's reputation and reviews online is also very important. So let me ask you this. If someone were to come to your office, what type of patient experience would they expect to receive?
Well, we try very, very hard to make it an overwhelmingly positive patient experience. And I'm very proud. I think a lot of people leave positive reviews about us online because we really do work very hard to make it positive. Before a patient even comes in our office, we mail them a welcome packet with information about me, about our practice, some DVDs they may find informative. We work very, very hard to run on time. Very rarely do I run late, and typically if that is the case, it's because the patient before came late. But we really try very hard to respect people's time and run on time. Every new patient appointment starts in this room, really, and we sit and talk with patients. I want to understand what their concerns are, what their goals, what they want to accomplish, if they have any particular fears or anything that they want to discuss. So in addition to fixing their dental problem, the dental problem ties into them really psychologically and what they want to accomplish. And if you don't spend time talking to someone, it's very difficult ultimately to satisfy their needs. When we do the implant surgery, we work extremely hard to make them comfortable. So we have some great systems, certainly local anesthetics, sedation. We have something called NuCalm, which is a non-drug way to make people very, very, very relaxed. So people can have their implant surgery, whether it's 1 implant or 6 or 12 implants, and be very comfortable. I keep in touch with patients after the surgery. They all have my phone number if they need to reach me, and we follow up tremendously. On top of that, I have a great staff. The ladies who work in my office are all first-rate professionals. They take their job very seriously, and they all work very hard to make people feel welcome and to feel comfortable in our office.
Sounds like you offer a wonderful experience. I know that you also offer some very special things to those patients who are considering dental implants and helping them to make a decision. Is there anything that you could offer right now that would help them?
Yes, Kathy. One thing that I see more and more as an implant specialist is I'm called upon to try to fix implant cases done by other practitioners who maybe don't have the level of training that I have. And it always would make me sad that a patient would sometimes choose an implant surgeon or not quite know how to choose that surgeon. They call around and they don't know what to ask, or they don't know how to interview surgeons to make a good choice. And I decided to write a book called The Smart Patient's Guide to Dental Implants. And there's 2 parts to the book. The first part really just discusses dental implants to give people an understanding of how they work, how they're used, and how they can benefit individuals. It's not technical, there are no gory pictures, but it really helps people understand what they're all about. And then the second part of the book are the 10 questions, what I think are the 10 critical questions any patient should ask a surgeon before having dental implant surgery. I've touched on some of them here in the interview, but I go into greater detail in terms of what somebody should ask and what they should look for in an answer. And then finally in the book, I've included the 3 most common mistakes I see patients make in terms of choosing a dental implant surgeon. And there are things that aren't always obvious, but I think if people are alerted to these potential mistakes, they'll do a better job in choosing an implant surgeon who's right for them. So I'd like to offer this book to your listeners. It's available on Amazon.com if somebody would like to purchase a copy, but for anyone listening to this interview that would like one, I'd be happy to give you a complimentary copy.
Oh, that's an option that you can't refuse. And if you're looking for dental implants, it sounds like it is a must-read. So if you see here on the bottom of the screen, the number you can call is 631-661-6633 to get your free copy of Dr. Scharf's book. I want to thank everybody for joining us today. If you are considering dental implants, I hope you will heed the advice of Dr. Scharf and check out that specialist reviews online, reputation, the expertise they offer, and the patient experience, so that it is similar to what Dr. Scharf offers. Thank you so much, Dr. Scharf, for joining us today. Thank you, everybody. Have a great day.
My pleasure. Thank you.